Hey guys, it's Luke Devsich here from Patient Rush, and today I have with me Jason Portnof from Surgical Arts of Boca Raton. Jason, thank you so much for coming on today.
Thank you for having me.
Awesome, good to have you here. Hey mate, so to get us started, give us a little bit of background on how you got into the industry.
All right, so I'm an oral maxillofacial surgeon. I went to dental school at Nova Southeastern University in Fort Lauderdale, Florida. I did my residency in New York at New York Presbyterian Hospital and Cornell Medical School. And then I actually did a year fellowship in Australia. I went to Melbourne, Australia for a year. I was at the Royal Children's Hospital. Yeah, in Melbourne. It was great. Great year. I wish I could go back and live there forever. It was awesome. And basically, I came back from my fellowship to the States, and I taught full-time at a residency program in New York. And then I dabbled in some private practice in New Jersey. Then I moved down to Florida, starting in faculty again at a residency program. And then I opened up my own office about 2 years ago.
Fantastic. Awesome. And so how's it been, like everything that we're going through this year, Jason? We spoke a little bit before we went on air. How's it been for you and your business, and how have you had to adjust?
Yeah, I mean, it's been, unprecedented times for all of us. I was fortunate enough, I take hospital call at about 6 different hospitals. So while, it gets a little bit hectic and stressful at times, it was pretty helpful to keep my doors open during this pandemic, in order to divert patients that were going to the ERs for dental and oral problems. They would send them to my office. So the ER, instead of admitting the patient, let's say for IV antibiotics and, treatment in the hospital setting, they would send them to my office, and we'd get them set up with IV antibiotics here, incision and drainage, extraction of necessary teeth. So all the emergency treatment, we were able to keep our doors open during times when everybody else had to shut down because we were, offering emergency care. So that was helpful to keep the, business going, and also provided a great service for, the public, because they were getting less risk by coming to my office. So there weren't COVID patients, and, staying out of the hospitals and the ERs,
Yeah, nice. And since sort of, a level of normality has come back, how's it been? Like, have you found things have kind of, obviously there's a lot of procedures that are different, but has the flow of patients in your business sort of got back to where it was?
Yeah, we're not quite at the numbers we used to be at. We're doing that intentionally. We're keeping fewer patients in the office, so we're seeing them one at a time, and we don't want a lot of family coming in. Basically, it's really the patient only, and except for kids, we would have like one parent, not two. No brothers and sisters, things like that. Now we're doing all the testing of temperatures and making sure there's no sick contacts and patients aren't sick before they come in. And then, as far as, what we're doing, we're almost doing, we're back to doing implants. We're doing wisdom teeth, elective stuff. There was a period of time when the governor of Florida wasn't allowing any elective procedures, but now that ban has been lifted. And so now we're able to provide, everybody with all that they need. And we're doing it in a safe setting. We've gotten tons more protective gear. We're wearing head to toe, like I haven't worn this in a while, but we started out wearing, full, full masks, and now we're doing a couple of N95 and a surgical mask on top of that. We're staying very, protected. We got new, suction units, extra oral suction units, and we put UV lights in our AC unit and things like that, and we're fogging the office. So we're doing a lot of extra stuff to make sure the public and ourselves are being protected.
Nice. Good on you. And in terms of, I want to dig a little bit into, you've opened this particular clinic. You mentioned that it's been 2 years. How important has marketing been for the clinic, and what are maybe some strategies that you've been successful with that you can share with the audience?
Yeah, well, marketing is a part of it. We're always working on something. We have Facebook page, we've got Instagram, and we're working to gain our numbers with those. And basically, we treat every patient, we hopefully as like their family. We try to treat everyone really well, and hopefully they have a great experience with us, and then they'll leave a nice review about us online if they're so inclined, and tell friends about us, things like that. And, you know, basically we want to try to make them to be fans of the office and fans of, you know, us. And by doing that, you know, hopefully, you know, we get a little bit of a following and some return business, and, you know, get the brothers and sisters of the patient that we've, you know, that we've seen and things like that, family members. So, you know, I think if we treat people right, hopefully that will be, you know, them passing our name around, and we'll get some more patients that way.
Yeah, fantastic. It's definitely the foundation of any you know, patient-based business, isn't it? Just providing excellent care, treating people really well, and it just sort of, it just grows like that, doesn't it?
Yeah, I mean, I think customer service is very important. I mean, we don't think of ourselves, you know, we're in medical and dental, you know, care. We're you know, we think you know, we're not above, you know, we have to treat the people right. You know, I mean, we can't just be thinking about procedures and diagnoses and things like that. There's a person attached to each of those, you know, procedures and diagnoses, and we want to make sure that the patient is cared for as an individual and they feel comfortable. And you know, we want them to have a warm feeling when they come to our office. We don't want them to be, you know, dreading going to the dentist or the, you know, oral surgeon. We want them to, you know, feel like, you know, they're welcome here and we're taking good care of them.
Yeah, that's right. It's interesting. I was on another podcast yesterday with another doctor, and he was telling me that, you know, it's fascinating how you guys are such highly trained individuals in your field. And he was explaining to me how there's just really there's no real emphasis on teaching you how to run a business, how to market, how to do things like that. And I want to ask you, do they, within your training, do they give you, you know, training on how to relate to patients and people and what you're just talking about now?
No, I mean, I think, no. So they don't teach in dental school. And, you know, you got to do a bunch of reading on your own. And, you know, I'll tell you, I mean, here, marketing lessons from the Grateful Dead. You know what I mean? I got it on my desk right here. You know, I don't know if it applies necessarily to our industry, but, you know, keep reading and looking at interesting stuff and looking at things in a new way. And you know, this is written by a guy named David Meerman Scott, who's a marketing expert. And he's got a book called Fanocracy out there. I just keep on reading books, you know, hopefully things will stick, you know, in my head, and I can apply these things to the practice. But there wasn't any dedicated class in dental school or medical school. So, you know, basically you got to figure it out on your own. So just, you know, trial and error, you know?
Yeah, that's right. Yeah, it's interesting. Oh, great, Jason. Well, mate, just to wrap us up, is there anything else that you would suggest to someone that's maybe just getting started, or they're trying to get to that next level, whether that be opening their first clinic or opening a subsequent clinic or just improving what they already have? What comes to mind that you would, you know, from your experience, that you would, you know, offer them?
Yeah, I mean, a bunch of things. You know, keep your mind open, keep learning, keep thinking about new ideas. You know, as far as when you start opening, I put a lot of people around me that were, you know, I surrounded myself with smart people. You know what I mean? I hired people that I knew for years, that I've worked with in the past, and I knew they were smart and they were good. And you know, you hire smart people and let them do what they need to do, and don't get in their way. You know what I mean? And you'll learn from them, and you know, that way you really let them shine. And by doing that, you'll shine. You know, because you know, you hired them for a reason. You know, so, you know, let them do what they got to do to make them successful and you successful. So I think that's part of the you know, the important strategy there. You know.
Yeah, fantastic. Oh, that's great advice. Awesome. Well, thank you so much, Jason. Really appreciate your time. And if anyone wants to,
I appreciate it.
Yeah, mate, really appreciate it. So if anyone wants to find you and, you know, reach out to you or anything, where's the best place to do that? Online, perhaps?
Online would be great. You know, our website, you know, you can get to us by email. We're Surgical Arts of Boca Raton, and we're in Boca Raton, Florida, South Florida. You can email me at info@surgicalartsofbocaraton.com. And, you know, it's great to be here, and I appreciate you including me in this. Thank you.
Great. Awesome. Thanks a lot, Jason.
All right. Thanks. Take care.